Hello, I'm Dr. Nimae Awantang, and I'm here in Panama City, Florida at the Hormone and Wellness Center, where I provide primary care services for adults and adolescents with special emphasis in bioidentical hormone replacement therapy and age management medicine. So I went to med school at Howard University School of Medicine, and I graduated in 2005. And while I was in med school, I signed up with the Army to pay for med school. So shortly after, I did my residency training in family medicine in Tacoma, Washington at an Army base. So I did residency for 3 years, and after residency, I was stationed in Fort Bragg, North Carolina, and I had 2 years of training, I say, with practice, because this was a paratrooper combat brigade unit for the 82nd Airborne. And so I was the field surgeon, as they call the primary care doctors, and that involved soldier care primarily, but also some dependent care, a lot of field medicine, covering a lot of jump activities and training activities as well. So right now I am at the Hormone and Wellness Center in Panama City, Florida. This is a primary care practice with specialization in bioidentical hormone replacement therapy. Very driven and heavy on preventive care. We do see a lot of ladies, but we have an active growing male population as well. An initial hormone consultation for guys or ladies would involve a full panel of basic hormone levels. We don't only look at the sex hormones, we also look at your thyroid hormones and your adrenal function. As far as hormone balance, it really is a symphony, and replacing one set of hormones without fully addressing another is going to reduce effective treatment. And so we really encourage our patients to look at it as a full panel and to remember that hormonal balance is our goal. We do encourage checking vitamin levels such as vitamin D and B12, because these are also very essential. There are minerals and elements that we would want to check and replace if deficient, because even subtle nutritional deficiencies can result in major symptoms. Bioidentical hormone replacement goes beyond symptoms and how you feel. A lot of us will notice because we will feel better, but there are multiple clinical randomized control studies that support the benefits of bioidentical hormone replacement therapy, specifically for cardiovascular health, for bone health, for memory, and just in general, the reduction of the aging process. And this is very important when we look at age management and maintaining function even at an older age. This directly affects your quality of life. Someone who is on bioidentical hormone replacement therapy, who is being followed and managed appropriately, can expect to maintain a certain quality of life and can expect to be healthier overall, with less need for pharmaceutical medications, less chronic disease, and less chance of malignancy. As a family physician, I've always been interested in health, nutrition, and prevention of disease. I love to promote health. I've been active in several communities that I've lived in, giving information, running health fairs, and talking to folks, educating them about what they can do to improve their health. One of my passions is giving back to the community. And having grown up as a kid in Central Africa, Cameroon precisely, I do a lot of trips back to Cameroon, where my parents still live. I've also done trips to other countries, but a lot of these trips are medical missions and very much emphasize prevention, and we do a lot of education, and it's one of the things that keeps me going, and I will always take time out of my schedule for a medical mission trip and an opportunity to give back in the community which I now live in here in Panama City. For more information or any questions, concerns, or comments, please follow us on Twitter, like us on Facebook. We are online, www.hormoneandwellness.com. See you there.